everyone to today's webinar, Payer EMR Access, How to Ensure Health Systems See Equal Gains in Efficiency and Outcomes, sponsored by Ensemble Health Partners. I'm Riley Wilson, a writer with Becker's Healthcare. Before we begin, I'm going to walk through a few quick housekeeping instructions. We'll start today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box on your screen, and we look forward to hearing your questions. Today's session is being recorded and will be available after the event. You can use the same link you used to log in to today's webinar to access the recording. If at any time you don't see your slides moving or have trouble with the audio, try refreshing your browser. You can also submit any technical questions into the Q&A box. We are here to help. Lastly, there will be poll questions during the webinar. We look forward to hearing your insight and experiences as we discuss today's topic. Today, we're joined by Stacey Sutter, the Senior Director of Payer Performance at Ensemble Health Partners. Stacey is an accomplished 20-year healthcare executive specializing in acute and physician revenue cycle operations. She is an adjunct professor at Western Kentucky University, where she has taught healthcare financial management and leadership courses for the past 10 years. Stacey has a strong history of leading contract renewals and negotiations and guiding health systems through out-of-network settlement engagements. Stacey, thank you for being here. At this time, I'll turn the floor over to you for the presentation.
Hey, happy to be here. Thank you all for joining me this afternoon for the presentation. I know we have several payers in the audience, so welcome. Hopefully we can connect maybe after this webinar and have some collaborative partnerships, so I look forward to that. So like she said, Payer EMR Access. Agenda today, direct payer EMR access, what that entails, how can payers and providers both mutually benefit from this EMR access, results from recent provider experiences. So we're going to go over 4 different case studies, 2 of which were very positive, mutually beneficial, and 2 which may be lackluster in some of those mutual benefits, and then recommendations for successful implementations as you move forward. So first, Ensemble Health Partners, who we are. We are a full-service revenue cycle management delivering holistic financial health to over 300 hospitals and providers across the country. We have a platform of service technology, business intelligence, analytics. We will manage the entire revenue cycle front to back so providers can focus on delivering exceptional care in their communities. So that's a snapshot of who Ensemble Health Partners are and the scope of what we do. So here's the first polling question. What EMR do you use? If everyone could take a minute to answer that, we've got Epic, Cerner, Other, or maybe you're unsure. All right, we've got about half that have answered. We'll give it another few seconds and then we'll close out this poll. Okay, so we have, of the audience, we have 61% Epic, 12% Cerner, 20% Other, and 6% unsure. So we definitely, like I said, we have some payers, we have some consultants in the audience, so they could fall into the unsure other category as well. And then do payers have direct connect to your EMR? This is the second polling question. So currently, do any payers have direct connectivity to your EMR? All right, so we're a little over half. Okay, so 32% yes, 68% no as far as direct connectivity. And then is your organization considering granting access to one or more payers? So that's a yes or no. I will add here, if your organization is a provider, if you've not been approached about direct connectivity to your EMR, you are probably going to be approached in the near future. We have more and more providers being approached by payers for direct connectivity in whatever shape or form that may be. So it's definitely something coming down the pipeline. And like I say, it can be very mutually beneficial to both the provider and the payer when it's done with the right parameters put in place. Okay, we are almost right at half. Okay, so 83% are considering and 16% are not considering. So those are solid statistics. So that's definitely good information. And then if yes, if you have a payer or payers that have access to your EMR system, what performance changes have you seen? So are you unsure if there have been any improvements as far as from the provider perspective? Reduction in requests for information denials. Have you seen an impact on your RFI denials? A reduction in prior authorization denials? Or have you actually seen an increase in denials, regardless if it's been requests for information or your prior auth denials? And we will get to one of the slides that go over some of the impacts that have happened with, payer access to the EMR to show some of these case studies. Okay, we will close this out in about 10 seconds. Okay, so unanimously, the answer is unsure if there has been an impact or what that impact may be. 7% have seen a reduction in first information, or request for information, first pass denials. 3% have seen a reduction in prior auth denials, and 12% have actually seen an increase in denials as a result of the EMR access being granted. Okay, so, this is a very important slide. There's not a lot on this slide, but one of your most valuable assets right behind the people you employ is your EMR data. So one of the things I want to implore and encourage you is you don't give away that access for free. Like I say, your EMR, one of your most valuable data sets as a facility. So don't give it away for free. All right, so payers are willing to pay a high price for EMR access. These are things we have seen firsthand for payers to gain access to providers' EMR systems. We have seen an offer of $250,000 to gain access to the EMR system, potentially to help offset the cost of building the technologies out for that interface. Policy overrides. Their payer policies, they're willing to, pick and choose a potential policy to override if given access to the EMR system. SIU exemption, that is a prepayment ED review where a provider is required to send medical records for level 4 or level 5 ED visits on the front end before they're paid. They're potentially willing to take the provider out of the penalty box for access to the EMR. And AR improvements, leveraging joint operation calls, the JOCs, and potentially payer provider meetings for AR over 90 days to show improvement if they have access to that EMR. So with this being said, the payer benefits are very clear why they want access. This is not secret information. It will definitely increase quality data. refine risk adjustment, and validate utilization management. So, you've got the scale here, and the payers definitely have streamlined benefits to getting access to your EMR. So we want to take this and either balance it or put the providers up here with these benefits. So when you talk about the payer benefits, it also reduces claim administration costs, which is a key benefit. When you talk about friction in the payer provider world, $85 billion in claims administration friction. Provider, $90 billion in friction costs. But the provider benefits also can reduce denials, accelerate cash flow, prevent lost records. I don't know that anybody's organization is unique, but you send a medical record and you call to follow up and they don't have that record, or they're not sure where the record may be, or they will attach it at the time you call, 7 to 10 days after you send it, which has caused a delay. But if they can go in and get that record in real time, there's no lost records. So it decreases that administrative burden and that time to pay your claim. So again, it helps reduce the friction and the administrative costs on both sides. So it can be strategically aligned and mutually beneficial. So these are some things that are available today. We've got Epicare Link, which is a list of payers that can go into the system. They may have a dozen, may have 24 specific users that can go in, they get access to your EMR, and they have a scope, they have a parameter that they can go in and get this access. They can go in for utilization management specifically. So you're opening it up to a set of folks that can go into your system and with a limited parameter get information. There's limited functionality based on the contractual agreement. Epic Payer Platform, which a lot of you on Epic have heard of Epic Payer Platform. So it's clinical data exchange, CDE for claims payment, electronic medical record prior authorization. So the unique thing with Epic Payer Platform is it is real-time data exchange, bi-directional exchange of data. And then we've got Cerner Oracle. I had a great conversation with one of the SVPs at Cerner a couple weeks ago. They are currently working on a proof of concept. So they want to know what do providers want. Providers want to reduce the request for information first pass denials. They want to get cash in the door quicker. They want to reduce their AR days. So they're working with payers and providers on a proof of concept right now. So they're trying to figure out mutually beneficial, strategically aligned goals for payers and providers for EMR access. So this is a slide that just don't provide unchecked access. So the top line is, whatever the case may be, payers have access to the EMR. This was, multiple payers got access in 2022, and then there was some more access granted mid-2022. They were allowed access, and their request for information first pass denials increased. The green line is payers that did not allow EMR access. They've been well below the percentage of those that did for the request for information first pass denials. The unique thing about this slide is guardrails and parameters were not necessarily put in place for those requests for information. You can get into the system, but hey, let's have a negotiation. Let's have a discussion on what you can and can't access. How is this going to benefit us as the provider? So I'm going to let this sit here for a minute, but really you should see this flip-flop where the green is on top and the navy's on the bottom, or the navy is all the way at the bottom where it is a straight flat line where the payers have access. They go get the information and stop denying the claims to send the request for information first pass denials. So again, it's all about the discussions. It's all about setting expectations on the front end and making sure everybody's aligned. So here's another one, increase in RFI denials after implementation of Epic Payer Platform, as well as Epicare Link. There's been significant increases after implementation versus even before. So once the payers have had access, there's been a spike of 15% and even 27% on requests for information first pass denials. So, provider C and D, this talks about negotiating favorable terms. So provider C was able to bring the payers to the table, discuss mutually beneficial goals, which ended up resulting in an entire FTE that, was retrieving charts pulling them, sending them to payers. They were actually able to take that FTE and put that FTE on a revenue generating function. There were contractual obligations that enforce the payers to pull the medical records. They're in there, they have access, pull them. They didn't need their staff doing that anymore. And then there was actual an obligation within 45 days. So when the payers went in and got the records, there was a time and date stamp saying they accessed this record, John Doe, at 9/26/2023 at 12:12 p.m. They have 45 days now to formally process that claim, to send a payment, to send a denial, but they have 45 days to fully adjudicate that claim. Work with the payers on that. Do you want 45 days? Do you need 30 days? Whatever the case may be, it's definitely a conversational point to get cash in the door and decrease your AR days. Provider D, they had multiple conversations. They had a payer that came to the table and said, hey, I'll raise my hand, let's figure this out. They had decreases in RFIs of 75% on the hospital side and 63% on the professional side. The payer was not going to focus solely on HEDIS and risk. They also decreased the administrative burden for the provider. It was definitely a lengthy contract process, but they had solidified shared goals. This partnership has been in place for quite a while, and it's still mutually beneficial today. So it's been a very successful partnership, which shows that EMR access is not always a bad thing. It can be mutually beneficial. You can take your folks pulling charts and put them on revenue generating functions, allocate them to where the organization may need that, and decrease the administrative burden alone on both sides. So, you need to know where these asks are coming from. At times they'll be brought up on joint operation calls. The managed care leaders, the ask may come to them. They're coming up during contract language renewals. Recently I saw where there was, something in the contract that said, hey, we'll open up discussions on granting EMR access. Just make sure you're aware of what's in the contract, what's being discussed. When it gets to that point, make sure you bring the right subject matter experts to the table. You've got your revenue cycle leaders, your managed care leaders, your Epic EMR liaison folks, your IT and compliance, and the payers. In order to have a mutually beneficial partnership, you need to have both sides at the table. You need to have those discussions and make sure that, hey, if you're getting this, we need this. So continue opening up those conversations and make sure that everybody's on board with the needs of the organization. And here are some takeaways for providers with ways to benefit from EMR access. You can completely eliminate or reduce your request for information denials. Pick out specific CAS codes, deactivate those. Work with your payers on that. Maintain windows within prompt pay guidelines, eliminating those RFI stall or delay tactics. Move to real-time prior authorization. Develop reasonable thresholds. Guarantee of payment with the electronic authorization approvals. These are, potentially, and then the shared savings from efficiency gains. These are potentially tiered approaches. These are potentially kind of kickoff points to start those conversations with payers. Ultimately, you've got to figure out what you need for your organization if you're going to grant that EMR access. But it goes back to, it's a negotiation. Work up what you need, what is the best for your organization, and go from there. I implore you to work with your payers, make it successful, and make it make sense for both parties. And, I'll pause here. We'll open it up from some Q&A. I definitely want to thank everybody. I do talk very fast, so I cover a lot of material very quickly. But just one of the big things is my email contact is here. I will also be at Becker's next week in Chicago. If anyone is there, definitely come up, say hi. I'd love to talk to you about EMR access, strategy, leveraging strategy, Ensemble Health Partners as well. So happy to make those in-person conversations. So I'll open it up to questions.
Great. Well, thank you for your great presentation, Stacey. We'll jump into today's Q&A session. You can submit any questions you have by typing them into the Q&A box on your dashboard, and we'll try to get through as many questions as we have time for. So our first question we'll jump into here is, who are some of the payers that you're familiar with working with and who have requested access to EMRs?
Sure. Great question. Humana, Anthem, and United Healthcare. Those are ones that I know that I've worked directly with. I will say, I've got a lot of experience, Epic. Humana with Epic Payer Platform, Humana is the one that has been on Epic Payer Platform the longest. They have the most modules built out at this point. But yeah, I mean, Humana, Anthem, United, those are some of the big ones that I've worked with.
Yeah, and what do you think should drive the decision points on what the guardrails should be for access to EMRs? Is it driven by operations or a payer strategy on the provider side?
It's a collaboration of both. So your operations can definitely bring up the data and the pain points. Payer strategy with your contract negotiations, you definitely need to have your managed care, your payer strategy folks in that room to say, when you get down to the contract piece of it, to have those folks be involved with the contractual piece of it. But you need to have some of your operators to come in and say, our big issue is the request for information first past denials. Here's specifically some of the things that we're experiencing, the pain points. But I also want to go over that I didn't cover is you've got to monitor this. One of the big things is, when you give a payer access, one of the big answers to the question was you're unsure what's happened. You have to monitor the success. So if you want to decrease your RFIs, you actually need to monitor, you need to measure, you need to track. If you put goals in place, you need to track it to make sure it's occurring. If you currently have payers that have access to your EMR, I challenge you to go back and look at what your baseline was before this access, what's occurred since they've been given access. Have you seen an increase? Have you seen a decrease? Has it stayed the same? And then if it stayed the same, what's the benefit of that access? You may need to reevaluate that and revisit those conversations.
Great. So looking at first pass denial, improved outcomes, did the observation rate go up for providers that granted EMR access?
Great question. I would definitely need to go back and look at some of the data as far as the observation rates. So I don't know offhand, but that's something I can go back and check.
And our next question is, what is Ensemble Health's role in the partnership with the payer and the provider?
Absolutely. So with us being front to back revenue cycle, we attend those monthly JOCs. We attend the managed care meetings. So we are the revenue cycle. So we work with the payers hand in hand. We work with the providers hand in hand.
Great. And, we have a lot more questions about, oh, sorry, go ahead.
No, that was all.
Great. So we have, more questions about, the relationship between payers, providers, and Ensemble. Have you seen payers get access to EMRs for other use cases like provider directory, credentialing information, member contact, things like that?
Yes.
Great. So just clarifying, those are the use cases you've seen. Our next question, from the payer side, what is something that we should expect healthcare systems to expect from us in exchange for access?
So with the risk and the HEDIS, is that maybe the question in addition to that, or?
I believe so, yes. What on the payer side, what should healthcare systems, expect to get from payers in exchange for access?
Oh, sorry. So kind of the last slide that I went over, decreasing the request for information, first pass denials, if you're in there and you have the access, getting those medical records, those itemized bills, authorization relief, some of those specific items, but it's essentially up to the healthcare system to determine what their biggest needs are, some of their pain points, and have those conversations. But RFIs, authorizations, those are some of the big takeaways.
Great. And another question, from the payer side here, as a payer, it's been a bit challenging to engage with the appropriate point of contact for provider EMR engagement. What are your recommendations on rules of engagement?
As far as maybe a point of contact, at your providers, start with maybe your managed care departments, because they have, the contract negotiation skills, but they also can gather some of those right people in the room and strike up those conversations.
Great. And our next question, are payers requesting a connection to the EMR to extract specific data points, or user access to review charts or clinical data?
So can you go over that question again? Because I know the second half, there are users that will go in to look at clinical data. So that's one specific access point. And what was the first part of that question?
Are they requesting specific data points or access to review charts?
So with the specific users, yes, it was around utilization management. That was the specific access for the users going in that have the individual access where they can manually go in and pull information.
And how can you verify that the records are only being accessed on an as-needed basis?
One of the things, you pull an audit trail and you actually go in and look at, what the users were looking at, what they've accessed. You go in and follow up on that audit trail. There's so many things you can look at within an audit trail to actually kind of peek under the hood per se, to see what they were looking at on the patients, the type of patients, the dollar amount. I mean, go in and mirror what they were doing and see what the users were accessing.
And how are provider departments impacted by EMR access?
It can be a great impact if the terms are negotiated correctly on the front end, if that makes sense. So it can be a tremendous relief, or it can end up being a burden. It just depends on the specific negotiations that are made.
And our next question, why would a payer spend, $250,000 to gain access to a client's EMR? Are they pulling clinical data for an AI model or any other purposes?
Part of my understanding with the financial incentives is to help the providers offset the cost that they're using for their IT resources and the infrastructure to build, especially if they're going on Epic Payer platform for the first time, to help offset that cost. But it also, with the payer benefit that the payers are able to gain from the EMR access, it's definitely worth it in the long run.
And are these auths for prior authorizations or concurrent authorizations or both?
Both.
And are payers allowed to pull data and implement AI or machine learning on the data? And if so, are there any security or compliance implications to allowing them to do that?
No, they're not supposed to. But again, I strengthen and challenge you to make sure you put that in your contract. But like with the individual users that are going into the system, there are specific users with specific IDs, sign-ons that are actual people. So there should not be AI, bots, any type of that running in the background.
And how limited of access would you suggest to give to payers?
Again, it's all part of the conversation. The payers will come with, hey, here's what we need and here's why. You go back as a provider, you go back and say, well, here's what we need and why. So it's those discussion points, but that's where your security, your privacy, your compliance folks need to come to the room and make those calls on what you're comfortable giving to make sure that they have what they need, minimal necessary, and you get what you need out of it. So I encourage your privacy, your compliance, your HIPAA, all those folks to also be interconnected in that room to make sure all bases are covered.
And in your experience, are any payers willing to pull data for HEDIS only in a trial before moving to other functionalities?
Yes.
And do you see increases in denials after a payer gains access to EMRs?
Yes, there was a couple of case studies that show the first pass request for information. That's going to be your medical records, your itemized bill, request for information that's coming in before they'll process the claim. Yes, we have seen a couple of case studies where it has been implemented, access to the EMR, and those have increased somewhat significantly.
And what is the most familiar platform that you have experience working with?
The most familiar is Epic, by far.
And is there an actual contract that needs to be signed when you're looking at these agreements?
Ultimately, like I said, you come to the table, have these discussions, set the expectations on the front end. But when it comes down to it, there is a contractual obligation that both parties need to sign to, here's the terms we agreed upon, here's the parameters we are putting in place, here's the success measures that we want to define this. But yes, there needs to be a signed contract by both parties for everyone to be held accountable. So yes, of course.
And in your perspective, do payers gain more than providers through the EMR access?
In current form, yes. But at the same time, moving forward, if the providers are having those conversations, it can be mutually beneficial, such as the couple of case studies that, we talked about where they were able to allocate an FTE to revenue generating functions, where this other provider was significantly able to reduce RFIs, professional and acute. So it can be mutually beneficial if the parameters are put in place on the front end.
And have there been cases where the payers are accessing the EMR and paying for encounters at a downcoded level if the documentation does not support services billed?
So I have not seen that personally in accessing the EMR through an electronic means. So I really can't speak to that one.
And a question clarifying something you talked about earlier. Is it correct that first pass denials increased significantly when EMR access was granted?
Yes, that is correct. And there was the couple of charts that I showed, as well as the bar graphs that I showed.
And are you hearing from providers that this is saving them time and money? Sending clinical data to payers can be a complex process.
Yes, absolutely. Yes, thus the allocation of an FTE to a revenue generating function when previously she pulled charts. So it definitely can be time, revenue saving, and reduce friction. So yes, beneficial.
Have you seen any scenarios where a payer gains access to the EMR and in turn providers are going to get direct access to the payer's APIs or something like that?
That's definitely a discussion point worth pursuing. I have not seen that personally, but at the same time, it's absolutely a discussion point, and I would encourage you to pursue that.
And if, denials are increasing, what is the benefit for the provider?
When you are potentially giving unchecked access to your system, you necessarily are not gaining a benefit, which is why you come to the table and have those discussions to say, hey, if I'm giving you access, here's what I need to get in return. So sometimes it's not beneficial whatsoever until you can have those conversations and negotiate some terms to make it mutually beneficial.
Great. Yeah, well, we'll leave it open here for a minute if there are any more questions to submit through the Q&A.
So, just to kind of reiterate, I think there's been a couple of questions, but, unchecked access, you're going to see an increase, and we have seen an increase in some of the case studies in requests for information first pass denials. So that's why it goes back into the negotiations, the discussions, setting the expectations on the front end to reduce those first pass information, requests for denials if you were given access to the system. So again, EMRs, providers, biggest resource behind people. So make sure that you're getting a benefit from giving this access.
And another question here, are hospitals concerned with payers getting access to PHI not directly related to their members?
Yes, they are concerned. It should be a concern. That's another area that you need to document in the contractual agreement. If there is a type of breach, who's responsible, the steps that will be taken if there is a type of breach. So it's definitely a conversation, and it's something that you should be concerned about, but at the same time, have those conversations and make sure it's covered in the contract.
And do you know the average cost for a smaller health plan to purchase the Epic Payer platform?
I do not.
Great. Well, thank you for all of those wonderful questions. Stacy, I want to toss it back to you. What is one key takeaway you have to wrap up your wonderful presentation?
Like I said, if your hospital, your healthcare system has not been approached yet about the EMR access, they will be. They're going to be approached soon if they have not been. So I implore you to have those conversations with, hey, if you want access, it can be strategically done. You just need to have those conversations with, if you want access to my system, here are things that I need. And you need to, memorialize that in the form of a contract. So that's the key takeaway. Just make sure if you're giving access to one of your most valuable resource that you're getting value in return and you're not giving unchecked access to your system.
Great. Well, thank you so much, Stacey, for joining us and for your insights. That's all the time we have for today. You can access this webinar again through your webinar platform. And I want to thank Ensemble Health Partners for sponsoring today's webinar. And thank you to everyone for joining us today. Enjoy the rest of your day, and we look forward to having you join us for future webinars.
Thank you.